LIC is the Longitudinal Integrated Clerkship, where it gives medical students the opportunity to practice and to basically practice their medical skills that we learned in medical school in rural sites in Arizona.
We have huge needs for rural physicians, especially primary care physicians in Arizona. And when I say rural Arizona, that's most of Arizona. The more time that students can experience rural practice and training in a rural setting, the more likely they are to be interested in doing that and envisioning themselves coming back one day to practice medicine in that kind of setting.
It is really important for medical students to have a rural rotation because we're medical students in Arizona, and Arizona is mostly rural. We have a lot of rural counties. We have a lot of rural counties that are very high need areas. And without the exposure to those rural counties and without the exposure to those rural medical systems, students aren't really going to understand the needs of Arizona and the needs of a lot of the patients they're going to be working with.
It gives you a different aspect of patient care that not a lot of people get when you're in urban settings. And I think when you're really being in those communities and really understanding and seeing what the healthcare is like, I think it helps inform the care that you have in the future as well.
The benefits of doing a rural rotation is that you really get one-on-one time with your attending. So usually there aren't any other residents during your rotation. The attending gets to know you really, really well during that time. They get to see your growth. They really get to invest time into your learning. And you also get to know your attendings really well. So you get to understand their clinical reasoning a bit better, and that kind of helps solidify some of the medical concepts as you're learning.
For medical students, we need to try to encompass as much diverse clinical experiences as we can. And I think having that experience in a rural setting really allows students to be able to understand and get familiar with those settings to better inform their practice moving forward.
It is definitely a really good opportunity to give yourself a chance to explore new areas in Arizona, whether you've been there or not, and work with physicians and teams that recognize the population that they're serving.
It was the best possible growth experience I could have had, just being able to be in that place for an extended period of time, have the patients really trust you. I think that is one of the big things about rural communities is that having patient trust is number one.
This experience has shaped me as a medical student in a lot of different ways. I think just building my confidence, working with doctors directly and with patients directly, I think it built my confidence, really helped me get better with my skills and my knowledge in medicine.
I think that everyone should give an LIC a chance, even if they hadn't originally heard of it in first year, or it was just something that came up briefly in second year when they were learning about clerkships.
I would encourage students to do a rural LIC rotation just to get the experience, to get to really immerse yourself in a new community in Arizona that you might not have been exposed to before, to get to know some physicians, get to gain better mentorship, and yeah, just to really build those personal skills that I feel like will carry on to your future career.